head the emergency departments for Apollo hospitals at Chennai. I'm here to talk about triaging patients. Triage is an essential process that happens at the outset. More often it's done by our senior nurses. Triage is essentially to see and sort out patients as they come in. The whole idea is to identify those patients who need immediate care and urgent care. So if they have breathlessness, chest pain, or what we call a airway breathing or circulation threat, or perceived to have one such, and all chest pains, we triage them as priority 1 or immediately to be seen patients, and they are often taken into our resuscitation room directly. If the triage nurse is being overwhelmed by the number of patients that need triaging, another nurse or sometimes even a doctor would give her a hand. So priority 2 patients would be less acute. Say they may be breathless, but they may need something like chest nebulization and monitoring. So somebody with a slightly faster heart rate, for example, would be priority 2. If they are in very severe pain, they would be classed as priority 1. Severe but not so severe pain would be priority 2, and so forth. Priority 3 are our stable patients. These prioritizations come from a structured, modified Australian criteria that we follow. Triage is a dynamic process. We would have to triage and re-triage patients at times. Say someone who's been very sick initially, say someone comes in with breathlessness from a heart failure. After the first half an hour, 45 minutes of treatment, they may often settle down and become slightly more stable, in which case they would be re-triaged as priority 2 and moved to be just for monitoring. Similarly, someone with a very fast heart rate being unstable, initially be seen as priority 1, will later be re-triaged as priority 2. So it has to be a dynamic process for optimal utilization of your resources, beds and your manpower. We also have to identify communicable diseases. Specifically speaking, diseases that need isolating right at the beginning as they come in. So we have an isolation room and we have areas to isolate in other areas of the hospital too. So unless based on specific criteria for isolating communicable diseases, then we would be increasing the risk of these diseases being transmitted. So we will have to identify communicable diseases at the outset. So this is all about triage. Patient safety is a very dear thing for us at Apollo. Thank you.